Hello everyone, my name is Brittany Bryant. I'm doing a video on idiopathic intracranial hypertension, or some know it as pseudotumor cerebri. I was diagnosed in January of 2012, following a miscarriage on December 30th, 2011. Um, I went for a normal, everyday visual test because I noticed my vision had gotten worse, and I drove a daycare bus, so I was kind of concerned. So I went and he did the regular normal vision test that you would have done, and my vision was bad enough it needed glasses. I'm not exactly sure what the prescription is for my glasses, but it's pretty bad. Uh, he then looked at my optic nerves, somehow using some kind of camera, took pictures. And when he looked at him, he said the first thing that came to his mind was wow. He immediately wanted me to look at what a normal optic nerve would look like and what my optic nerve looked like. Mine was severely swollen, um, compared to the other. He immediately told me he wanted me to go to this was my optometrist, I'm sorry. He wanted me to go see an ophthalmologist that week. So he sent me, and before he left, he said it could either be a brain tumor and my mouth dropped open, or idiopathic intracranial hypertension. So, of course, you automatically assume the worst. Um, I immediately thought I was dying of a brain tumor. But that wasn't the case. So, anyways, went to the ophthalmologist. He checked my eyes, did the visual field testing to see about my peripheral vision and all that. It came back abnormal. He was trying to explain it to me. My brain doesn't really soak in all this information like it should. Um, he immediately sent me to a neurologist, Dr. McDonald, over in Gainesville. I live in Gainesville, Georgia. Um, he immediately wanted to do a lumbar puncture. Spinal tap is another name for that, just to clear things up. Sent me to Northeast Georgia Hospital. He met me over there, did the lumbar puncture. I cannot remember for the life of me what exactly my opening pressure was, but he screamed when he got the needle in because he said the fluid shot out over the little thing that they use, manometer, I think it is, or something. Not really sure. Don't hold me on that. But he immediately put me on 1,500 milligrams of Diamox every day. Side effects from that is crap. You can't drink Coke, which I'm okay with not drinking Coke, but um, it tastes like absolute crap. It makes my food taste gross. Since then, I have moved up to 4 grams of Diamox a day, which I think is like 4,000 milligrams. I'm not exactly sure how they do that. Maybe only 3. I know it's 4 250 milligram pills 3 times a day. Um, after all that, the first LP and the medication he gave me, we tried several medications. They wouldn't work. So he sent me to a neurosurgeon, which is Dr. Mahana, who is over in Gainesville as well. Can't stand him, just by the way. He immediately wanted me to have an LP shunt placed, said that he could not do a VP shunt because my ventricles in my brain were too small. So he sent me for an LP shunt, and he said he was sorry that most of the time that these failed. So just to look forward to several surgeries, um, which I was not excited about. I went in thinking that this was going to be an easy surgery, and I was wrong. He had me schedule surgery for June 1st. I went to see him like May the 28th, and May the 28th, and he had me in for surgery June 1st. Went in, had that surgery done. Miserable surgery, miserable recovery. I mean, I was absolutely just in so much pain, it was ridiculous. He actually had to cut my vertebrae in my spine in half, 2 of them, because he couldn't get the shunt tubing in. Um, I'm going to explain a little bit what an LP shunt is in case people don't really know. Um, LP stands for lumbar peritoneal. Um, the lumbar is your spine, the lower spine, and then the peritoneal cavity is somewhere in your stomach. I'm not exactly sure where it's at. This particular shunt or tube is used for neurological disorders and so is used in the cranial region, which you could also have a VP shunt. That's what, when I was saying VP shunt, that's the one that starts here and goes down and then goes into your belly or into around the heart cavity. Um, it says lumboperitoneal shunts fail more frequently than do shunts between the ventricle and the peritoneum. A shunt failure may not occur for many months or even years after placement, or it can occur immediately after placement. As for me, my first revision came June 26, 2012. The shunt catheter had pulled loose from my stomach. I know I'm screwing up my hair and I look like a crazy person today. I had to go back in for surgery on June 26th, which that surgery was a piece of pie compared to the first one. I was home a couple of days later. As the first one, I was like in there for 4 or 5 days, which was crazy. Now the shunt's not working again. So I went for my MRI yesterday, and they gave me some good stuff, some Valium, so I was feeling pretty good because I'm claustrophobic, so I wasn't too bothered by the tube that I had to get into. I go to Emory Neuro-Ophthalmology May the 9th to find out what I'm supposed to do. I've also had another LP lumbar puncture done just last Tuesday, which was the 2nd, I believe, of April. He couldn't get in, couldn't get any fluid off because my anatomy has changed since my first surgery. Go figure. So now I'm just waiting. Just waiting and waiting and waiting and playing the waiting game while my eyes bug out of my head. I kind of wanted to read a little bit about idiopathic intracranial hypertension just to get some awareness out there, just in case you don't know what it is. It's also called sometimes by the older names benign intracranial hypertension or pseudotumor cerebri. It is a neurological disorder that is characterized by increased intracranial pressure around the brain in the absence of a tumor or other disease. So it's basically like you have a tumor, but you don't have a tumor. It has all the symptoms of a tumor, but you don't actually have one. The main symptoms are headache, which is not really a headache, it's head pain, excruciating pain, nausea and vomiting, as well as pulsatile tinnitus, which is like buzzing or whooshing in your ears, which is very annoying, let me tell you. Double vision and other visual symptoms. If untreated, it may lead to swelling of the optic disc, which I have in the eye, which can progress in vision loss. It is diagnosed with a brain scan to rule out other causes, and a lumbar puncture always. Lumbar puncture may also provide temporary and sometimes permanent relief from the symptoms, by far not permanent. Some people respond to medication, which is the drug diamoxacetazolamide, same thing, but others require surgery to relieve the pressure, which I did. The condition may occur in all age groups, but is most common in young women, especially those with obesity. And you will hear that. You need to lose weight, you need to lose weight, you need to lose weight, blah, 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 blah. But let me tell you something. There are a lot of women and children that are not big at all that have this condition. So what the heck? You know, they want to blame it on overweight, but yet I still had these headaches when I was 135 pounds. So I don't know. I don't know. But anyways, I just wanted to give a heads up on my story and what's been going on so far. And I hope you get a little bit of information out of this rambling that I'm doing. Take care and God bless. And if you have any questions, just post them down below. And I'll answer them just as quick as I can. Have a blessed day.